Feeling frustrated with the lack of answers in your fertility care? I'll be shedding light on the overlooked challenges women face when navigating fertility treatments. Here's what's coming up in this episode. Why standard OB-GYN visits might be missing key diagnostics. The real story behind AMH tests and common misconceptions. I'm also going to teach you how to advocate for yourself and ask for the right test to get answers. This episode is packed with insights to help you take control of your fertility journey and empower you with health decisions. Don't miss it. Welcome to Fertility and Wholeness Podcast. Are you tired of seeing that test be negative month after month? Will you ever stop having to take test after test? Are you scared of all the medical terminology, office visits, and misinformation you see at every turn on your infertility journey? If you answer yes to any of those, you're not alone. You are at the right place. I'm so happy you're here with us. My name is Arianna. I'm a fertility care practitioner and a wholeness coach with over a decade of experience on the field. I created this podcast because I know what it is to feel alone and lost while navigating fertility problems. And after helping hundreds of women, teaching them how to not protract their cycles, boost their fertility, and navigate their monthly emotional roller coaster and get pregnant naturally, I am on a mission to empower women to take charge of their fertility journey. In this podcast, you will find heartfelt conversations, education, tips on how to take care of and understand your fertility, emotional support, simple lifestyle changes to boost your fertility, nutrition, self-care routines, tips for handling stress and anxiety with ease. We have amazing, exciting expert interviews and guests, inspirational stories, and practical advice on preparing for pregnancy and joyful delivery. Are you ready to reclaim your health, your life, and become pregnant naturally? If so, grab your green juice and prenatal vitamins. This episode is just what the doctor ordered. Welcome back to another episode. Today, we're tackling a deeply personal and often overlooked issue. Feeling overlooked by a standard OB-GYN care, especially when it comes to fertility challenges. For many women, the journey through fertility issues can feel frustrating, like you're not being fully heard, or your concerns are often dismissed as normal, when you know something isn't right. Now, think about it this way. Imagine that you're driving your car and suddenly the check engine light comes on. You're not entirely sure what's wrong, but it is clear that something is off. So you take the car to the mechanic. The mechanic glances at your car, checks the oil, peeks under the hood, and tells you, everything looks fine. The light must be a glitch. Drive around. If it stays on, come back later. Drive away feeling uneasy because the light is still there. Sure, it could be a minor issue, but what if it's something bigger? What if your car breaks down when you need it the most? It doesn't sit right with you. Now imagine that if that mechanic took the time to truly listen and dig deeper, instead of brushing you off, he runs all full diagnostics. He checks every sensor and wire and finds a hidden issue, a small but critical part that could have caused major problems down the line. By addressing it now, he saves you from a costly repair later. Your body's like that car. Sometimes you get the check engine light in the form of irregular cycles, unexplained symptoms, or difficulty conceiving. And just like that quick mechanic, a routine visit to the doctor might only offer a surface level glance, telling you everything seems fine, but you know something isn't right. Just because the surface looks okay doesn't mean that there isn't an underlying issue affecting your fertility. That is why it's so important to ask for those deeper diagnostic tests, so you can catch the problem early on and avoid bigger frustrations later on. Don't just accept a quick check. Be like the car owner who insists on getting the diagnostics done. When it comes to your health and fertility, you deserve more than a quick glance under the hood. You deserve real answers. Like we just talked about the mechanic and the dashboard light story, when something feels off with your car, you don't settle for a quick glance under the hood. You want a thorough checkup to get to the root of the issue. Unfortunately, many women seeking help for fertility challenges face the same issue, surface level care that doesn't dig deep enough. Many women who visit the OB-GYN for fertility concern are giving the same advice. Try for a few months and come back if nothing happens. This can be incredibly frustrating, especially if you've been trying for a while or have the emotional pain of miscarriage. Feels like time is slipping away without real answers or action. On the flip side, some women might feel reassured after a routine checkup, hearing that everything looks normal, especially after a pap smear or a basic gynecological exam. But here is the thing. Those routine exams aren't designed to assess fertility. Just because everything seems fine on the surface doesn't mean there isn't an underlying issue. If you've been told everything looks fine, but you are struggling to conceive, you're not alone. It can be very confusing and frustrating to get a green light on paper, but still face challenges. This is where deeper testing becomes essential, even though it is rarely offered without asking. Routine physical and basic exams like a pap smear are important for the screening for things like cervical cancer or infections. But these tests don't assess your fertility. If you've been struggling to conceive, it is possible that critical areas like hormonal imbalances, nutritional deficiencies, or thyroid functions are being overlooked. Just because your doctor says everything looks normal doesn't mean there aren't deeper issues that need attention. It is time to go beyond the routine checks to get to the bottom of your fertility concerns. You need to advocate for more comprehensive testing. This means asking for blood work that looks at your hormone levels, thyroid function, and even nutrient deficiencies. These deeper tests can identify underlying problems that might not show up in a basic exam but are critical for fertility. Here is a few key tests that you should request from your doctor. The first one is a hormonal panel. This test will look for key hormones like estrogen, progesterone, FSH, or LH. It is important to test them at specific points in your cycle to get an accurate picture of your ovulation health. And then usually the doctor would do an initial one to establish a baseline and another one after ovulating, typical around day 3 and day 21 of your cycle. But it is important for you to understand when are the tests being done to get accurate results. Thyroid function tests, TSH, free T4, free T3. An underactive or overreactive thyroid can interfere with ovulation and pregnancy. Make sure to ask for a full thyroid panel, not just a basic TSH test. AMH test. This test helps estimate your ovarian reserve, or how many eggs you have left, which gives you a better understanding of your fertility potential. Vitamin and nutrient testing. Nutritional deficiencies like low levels of vitamin D, B12, iron, or folic acid can impact your fertility. Testing for these can reveal something simple, like a deficiency that is contributing to your struggles. So now that we have discussed a specific test to ask for, I want to touch on an important point, particularly about one test that often gets a lot of attention, the AMH test. AMH can give you a snapshot of your ovarian reserve, essentially how many eggs you have left. It sounds like a simple way to gauge fertility potential, right? Well, not exactly. While the AMH test is valuable, there are common misunderstandings or what I call a fallacy around it. Many women are told that their AMH levels are the ultimate indicator of their fertility. And if the numbers aren't high, they're often rushed into aggressive treatments like IVF or told to freeze their eggs immediately. But basing major decisions on a single number without looking at the bigger picture can lead to unnecessary stress, anxiety, and sometimes even disappointment. Here is the thing about AMH. It gives us an estimate of egg quantity, but it tells us nothing about the quality of those eggs or your overall reproductive health. So while a low AMH might suggest that the number of eggs you have is reduced, it doesn't mean that you can't conceive naturally or with minimal intervention. In fact, many women with low AMH still go on to have healthy pregnancies. And this is where the fallacy comes into play. AMH is just one factor in the much larger puzzle of fertility. Focusing solely on this one test can push women towards aggressive fertility treatments prematurely, without fully assessing other crucial aspects like hormonal balance, equality, thyroid function, or even lifestyle factors. Imagine making a life-changing decision whether to undergo IVF, egg freezing, or other treatments based on one test result alone. It's like judging the health of an entire car based on one dashboard light. Sure, it tells you something, but it's not the full story. When doctors and patients hyper-focus on AMH, they often overlook other factors that could either be resolved with less invasive methods or might not be the issues at all. For example, a woman with a low AMH that balanced hormone levels, not a significant nutrient deficiencies, and regular ovulation might still conceive naturally. Meanwhile, a woman with a high AMH could still face challenges if underlying hormonal or reproductive issues aren't addressed. Before rushing into decisions based on AMH alone, it is essential to take a step back and consider the whole picture. Hormone panels, thyroid function, lifestyle factors, and even mental well-being all play a role in your fertility. And often, taking a comprehensive approach to your health can improve fertility without the need of aggressive interventions. So, when you're speaking to your doctor, it's important to ask for full assessment, not just the AMH test. Ask about the quality of your eggs, ovulation health, and other factors that could be influencing your ability to conceive. Fertility is complex, and relying on a single marker like AMH can lead to more frustration and confusion down the road. This brings us back to the point I made earlier. You need to advocate for yourself. Ask for deeper tests, thyroid, hormone panel, nutrient levels that will give you a clear picture of your reproductive health. Don't let one test define your journey or push you into decisions that you're not fully ready for. Fertility is more than a number. By looking at the whole picture, you will feel more empowered and better equipped to make decisions that are right for you. Now, advocating for yourself can feel intimidating, but you deserve a thorough care. Here's some of the phrases that you can use to make sure your concerns are taken seriously. Come from a place from empathy. You can say something like, I appreciate that my routine test came back normal, but I know my body, and I like to explore more deeply to ensure nothing is being overlooked. Be specific and assertive. You can say something like this. I've been tracking my cycle, and I am concerned that I may not be ovulating regularly. Can we run hormone tests at key points in my cycle to check? Show up like you have done your homework. Mention a specific test like hormone panels, thyroid function tests, and explain why you think they might be relevant. Come from a place where you're asking for solutions, not just reassurances. You can say something like, I understand everything looks fine, but since we're trying to conceive, I like to proactively rule out any potential issues now rather than waiting. It is normal to be nervous or afraid of being dismissed by your doctor, especially if you have experienced that before. But remember, you have every right to advocate for your health. A good doctor will be open to your concerns and willing to explore more in depth. If they're not, it might be time to find a new one. Another way to advocate effectively is by tracking your cycle and symptoms. Keeping record of anything that is off or concerns give you more leverage in your conversations with your doctor. It shows that you're serious and have been proactive about your health. This is especially helpful if you're discussing concerns about ovulation and other fertility-related issues. Now that you know the deeper tests to ask for, it is time to take action. Schedule your next appointment with confidence. Start tracking your cycle and symptoms and go in prepared with the right questions. If you're feeling lost or overwhelmed, I'm here to help. In the comments, you will find a freebie about understanding your cycle. Feel free to go in and download it and use it as a resource. If you'd like to go deeper, I teach women how to take charge of their cycles, advocate for themselves, and optimize their fertility. Reach out anytime. I'd love to support you on your journey. In the next episodes, I'll be talking about how to push for even more in-depth investigations if this test is still leave you with unanswered questions. So make sure to come back. That's it for today. Thanks for tuning in. If you enjoyed today's episode, we got a special treat for you. Join our free Facebook group where you can connect with other amazing women and share your thoughts. Join us by clicking in the link in the show notes. We can't wait to welcome you into our supportive community. And don't forget to come back for our next episode, where we'll be sharing even more inspiring stories, encouraging tips, educational insights, and practical strategies. Oh, and before you go, we have a tiny favor to ask. If you found today's episode uplifting and helpful, please leave us a review. It's like giving us a virtual hug, and it helps other amazing women like you find our show. Plus, it makes us smile from ear to ear. And hey, why stop there? Share the love. Tell your Betsies, your mom, your sister, and even your favorite barista about our podcast. The more, the merrier.